the key is treating the immune system. If you fix the immune system, you get rid of Lyme disease. What we call Lyme disease is typically thought of when people get acute Lyme. They get bitten by a tick, a week or so later they get flu-like feelings and a rash, and they have a typical syndrome treated with antibiotics and goes away. But that's a fraction of the people that have chronic Lyme disease. Chronic Lyme disease is very different. It basically, you usually don't know when you got it. Majority of people have no idea. They've never been really high risk for a tick infection, and they go along no problem. All of a sudden, 5 years, 10 years later, when they have a significant stress, death in the family, a divorce, emotional trauma seems to really be able to trigger it, but also, let's say, a car accident or another infection, that immune system starts shifting, then all of a sudden they get hit. The body can't suppress that Lyme, it comes out, suppresses the immune system more, all these other infections, and like, oh my gosh, what's going on? I've been diagnosed with fibromyalgia, been diagnosed with chronic fatigue syndrome. So it affects almost every cell in the body. So which is why Lyme patients, they have usually 5, 10, 15, 20 other diagnoses, which aren't necessarily incorrect, but it's what's causing it. And it becomes a chicken or the egg saying what causes it. So you have to treat all those different components so now the body can actually fight the infection.